Welcome back to Health Law Pulse, the podcast where we explore how healthcare, leadership, and law intersect in the real world. I'm your host, Jonathan Rhodes, healthcare attorney and founder of Health Law Counsel, LLC. Today's episode focuses on a topic that's becoming increasingly important in healthcare compliance, the intersection of operations, technology, and risk management. For years, compliance programs were largely built around policies, training, and periodic audits. But healthcare organizations today are operating in a very different environment, one shaped by complex data systems, automation, analytics, and increasingly artificial intelligence. That shift raises an important question. How do compliance leaders manage risk in systems that are becoming more operational and technology-driven every year? To explore that question, I'm joined today by Brian Burton, Chief Compliance and Privacy Officer at Healthicity, a company focused on helping healthcare organizations manage compliance, auditing, and risk through technology and data-driven tools. Brian has spent years working with healthcare organizations across the country, helping them think about compliance not just as a regulatory requirement, but as something that's deeply connected to how organizations document care, structure workflows, and manage information. In this conversation, we talk about how documentation and data structure can quietly create compliance risk, the role technology and automation play in modern compliance programs, how organizations are using analytics to detect risk earlier, and why emerging technologies like AI may represent one of the most important compliance challenges of the next decade. This is Health Law Pulse. Brian, welcome to Health Law Pulse. Thanks for joining us today.
Thank you so much, Jonathan. It's a pleasure to be here with you today, and I'm looking forward to our conversation.
Well, it's an honor, and I appreciate your time. If I always like to start off with just asking a little bit about yourself. You could just describe your career, your background. I know you've been in healthcare compliance for a very long time, and just a little bit what you're doing at Healthicity right now.
Yeah, absolutely. Like most compliance professionals who've been in the industry for more than 10 or 15 years, I come from a different background, right? In 1997, compliance was new. And so I started my compliance journey just 10 years later in 2007. And I've been a dedicated compliance professional ever since. But I come from a technology and project management background. And so I don't have a clinical background or clinical experience, but I joined my first compliance endeavor was a project to manage payments to physician referral sources. And so from that project, I turned that into an opportunity or the chief compliance officer offered me a position on her team, and I was able to begin my compliance journey. And that was way back in 2007.
Well, excellent. I appreciate that. And then, first of all, I love the fact that you have this technology background because we're going to get into that a little bit later, which I think is certainly significantly more relevant today than it was when you started your career. And so I'm looking forward to your thoughts on that. But describe a little bit what you're doing at Healthicity. What is Healthicity, and what does it do in the healthcare space?
So Healthicity, we have two software solutions, and our primary goal is to help compliance professionals manage their compliance activities. So we have two software solutions, one to help organizations manage their audit functions, so we can inject claims data and then help auditors perform routine audits on various types of claims, both facility, pro-fee, dental, all types of audits. And it really helps the auditors manage the audit function itself, and then generates these really nice reports that compliance teams can then use for provider education. And then we also have another solution we call Compliance Manager. And Compliance Manager serves as the 7 elements of an effective compliance program. It is a tool that is designed specifically to help manage those OIG 7 elements. Everything from policy administration to investigations, auditing, managing the audit itself, the audit schedule. We do sanction screening and training and education.
Excellent.
And then,
yeah, go ahead.
I was going to say, in my role here at Healthicity, I'm the Chief Compliance and Privacy Officer. So I have 4 primary responsibilities. I manage our own internal compliance and privacy. As you can imagine, we're governed by HIPAA mostly, but we've structured our compliance program to mimic a provider-based entity. And then I help our product team and our sales team. And then we also have a boutique consulting branch. So we offer professional services to our clients where we can help them manage the compliance program activities. We offer services like assessing compliance programs themselves. We have a HIPAA security risk assessment that we can help clients with. We do tabletop exercises, the full gamut of supporting an organization's compliance program.
Excellent. And I love the significant role that technology plays in the solutions you provide to clients because it's so pervasive in this area now on all sides, from the government investigation side to the audit side, and certainly should be on the provider side. So we'll get into more about that a little bit later. So I appreciate you giving us that background. So Brian, let's just dive right in. One thing that I've observed over, and I've been doing this about 20 years, is many compliance issues originate in the on the ground operations, in sort of translating policies into action at the field level. So policies can be technically correct. We know we've drafted and we've reviewed many policies that look great. The real question is how documentation flows, how decisions are made in real time, how data is captured across organizations. So I'd like to start with just asking you, how do documentation, workflows, data structure quietly create compliance risk?
Yeah, so there's several risks there. Beginning with the technology side, the data integrity itself can present its own risk to the organization, right? And several years ago, I can remember 10 or so years ago, organizations really started to develop data integrity policies to try to understand where was protected health information in the organization and was it encrypted? Did we have the right governance and retention policies? And then the documentation, you bring up a great question. So how do we can have the most beautifully authored policy in our organization, but if our workforce doesn't know how to access it and how to apply it is one of the most critical aspects of compliance. And today, a lot of times we wear a hat where we're viewed as the internal enforcement arm of an organization, but most compliance professionals at their core, we're really there to educate and provide avenues of education and how to respond to potential conflicts with our policies and regulations. And so education is key, right? And helping direct the workforce members to the policies and then understanding how to apply those policies in their specific jobs.
Yeah, so practical training, practical education at the field level, and I imagine at all levels of the organization, right? Because compliance issues can be a problem from the very top to the
Yeah,
patient-facing field
absolutely.
level, everywhere. Everyone needs to be educated.
Absolutely. Everyone from our volunteers that might be greeters to our top earning providers, right? They all need to understand compliance from beginning to end, and specifically how it applies to their job, right? We really have evolved over time where we used to, in my early days, we would have a code of conduct and a mention of fraud, waste, and abuse, and then policies and HIPAA regulations were changing and we were modifying our education. But it really came down to as simple as an attestation of I read the code of conduct. Our training is much more robust now, right? We see we're not giving the same training to our CFOs that we are to our volunteers. We're modifying the training specific to the compliance training, specific to the job function that you're performing.
Yeah, I love that comment, and I've seen this. I'm sure you've seen it dozens of times where it's okay. The training has occurred. You kind of go through this online module. You sign this attestation at the end. You sort of tuck it away. What you're saying is that it's got to be more than that. It's got to be real practical as applied to your job training, so they know when confronted with X, Y, or Z issues. This is
Yeah,
react. This is how you don't react, and this is where you go.
absolutely. And we've seen this theme of micro learning come out, and the OIG is referencing that in the most recent guidance document as well. We don't want the old standard of just annual compliance training. Somebody sits down for anywhere between 30 minutes to 2 hours to complete their training. We want to produce compliance education on a defined frequency to make it relevant within the workforce. And so that we're not just remembered once a year, but the compliance team and the compliance officer is available to the workforce all the time. And we're proactive in that communication frequently throughout the year.
Yep. Yeah, that is so important. And I appreciate that. And I love this idea of micro learning. I love the idea of real practical training based on that, that's catered to the individual's role. Because when organizations experience compliance problems, it's not necessarily because someone understood a statute. No one is sitting there saying, "Well, I thought 42 CFR such and such said." That's not how it works. It's usually because everyday processes. It's this drifting concept, right? They slowly drift away from what the rules require. Sometimes the challenge is in identifying non-compliance. It's making it easy for people to raise their hand on what they see and when they see it. So where do organizations unintentionally, uh, let's sort of carve out the nefarious actors here, but unintentionally create risk in their everyday operations?
Well, I'm reflecting back on several instances in my experience. I've had the opportunity to conduct hundreds of investigations at this point, but unintentional can be anything from we have the wrong charge master, right? Right. We've produced an edit to the charge master, and we're unintentionally billing the wrong modifier, or it can be I'm thinking, reflecting back to a medical device issue that we had once, right? It can be, as simple as loss of communication and what it means to track the serial numbers on implantable devices, right? It's general unaware, an employee or a workforce member who is unaware of a requirement, and it could be anything, again, anything from a billing component to how to track and manage inventory or HIPAA, right? We forget to issue a notices of privacy practice to a new patient, right? It can be those unintentional. The workforce member is generally unaware of the requirements that interaction between us and the patient.
Yeah, that's a great thought. A lot of times, throughout my career, well, not a lot of times, unfortunately, but sometimes there have been times when someone has come to me, maybe someone in compliance or business, they said, "Hey, we have a False Claims Act issue here. We have a violation." Okay, well, tell me more about it. And it's, well, we've been billing incorrectly for, this code or this service. Well, as you know, that just billing incorrectly does not necessarily mean there's a False Claims Act violation. It requires the
Correct.
knowing submission of false claims. And knowing is a defined term, which certainly means actual
Will
knowledge versus deliberate ignorance or reckless disregard. And so it's this concept of, when I think unintentional, it's really more than just looking the other way intentionally. It's really sort of this concept of, I mean, just the little things like you mentioned, not giving someone a notice of privacy practices, or maybe there's a mandated change that needs to take place to the notice of privacy practices that we're just because of the infrastructure, because there's some operational failure, just didn't happen. So that those little things can really pile up pretty quickly in regardless of the size of the organization.
Absolutely. And I think, circling back to a previous comment, it building a relationship for the compliance officer and the team to build a relationship with the workforce and to create a streamlined process to bring questions to us. When you have that scenario of a potential fraud, waste, and abuse issue, or you just have a question about the applicability of a policy, right? Creating that dynamic relationship between the compliance team and the workforce to help navigate those difficult questions. To your point, right? We may have a billing issue, um, and our workforce might use the term fraud, and you and I know that fraud is completely different than waste and abuse, right? We want to help the workforce draw those delineations to protect our organizations, right? And when we have an overpayment scenario, we have an obligation to refund that money within 60 days. But we also don't want to hastily go through that process and refund more than what's required, right? We also have an obligation as a compliance organization to protect the organization's revenue as much as we do identifying overpayments.
Yeah, your comment about culture is really a common theme in discussions I've had with compliance professionals. It's making sure there's an environment where people aren't nervous to go to compliance, aren't scared to go to compliance, but it's more of an inviting, encouraged practice. I think that's really important. That's very common comment. Excellent. Well, Brian, hey, I want to shift gears to technology. I know you've got a great background in this, and currently your space in the compliance world very much revolves around technology. It's been one of the most interesting developments in the compliance space, I'd say, over the past decade. You would know better than I would. When I started practicing healthcare law, most compliance programs, they relied on some of the things we're discussing here, and nothing wrong with this, but policies, training, periodic audits, certainly a very important part of every compliance program now. But on top of that, we're seeing platforms, analytics, automation tools. Increasingly, AI is entering into the picture. And as you know, I'm looking forward to your comments on this. Technology can be a double-edged sword. It can reduce risk. It can also create new types of risk if organizations rely on it too heavily or not enough. But what does technology actually solve in compliance, and what does it not solve? What is the role of technology in all the things that we're discussing with respect to compliance programs?
There are, to your point, there are great benefits to using technology, and then there's also the detriments, right? And then the risk, the inherent risk that technology brings. From an automation, data storage, and auditing perspective, technology is fantastic, and our solutions at Healthicity really help organizations manage those functions, right? To inject a universe of claims and be able to create a statistically valid sample, and then audit on that. The method we use today in technology, whether it be Healthicity's tools or other ones, that process is much more streamlined today. We can audit claims data much more effectively than we could 10 or 15 years ago. And then data storage itself, right? And how we're managing data. Where is it stored? How are we managing the retention requirements? How can we programmatically manage the retention requirements? I'm reminded of Florida a few years ago released a state regulation that required organizations to purge data that was no longer right. So they moved away from the requirement of thou shalt keep this long to thou shalt not keep it any longer than, right? And so understanding those requirements and how to use technology to manage and maintain them are great. And there's in AI, and I won't profess to be any type of AI expert. I don't know that anybody's truly an AI expert these days, except for maybe the coders and the developers who are building it. But we're learning how to use it, and it will have a place in healthcare and healthcare compliance. It will continue to grow in its utilization and function. It will also bring inherent risk, right? I learned a new term a few months ago, a new term called hallucinations, right? And that's where AI gives you an incorrect result, right? And so understanding that AI is a great tool and it has a place and it will continue to grow, but it also has its inherent risk to it, and it still requires us as human beings to evaluate what it produces as a result and how to use it and where. And then that brings me, what does it not solve? Right. So from a pure compliance perspective, the human element itself, right? The AI, and there's no technology that's going to sit down. And even though you and I are using Zoom today to have this conversation, nothing will replace this interaction and our human to human contact because we're delivering healthcare, we're delivering care to the human being. And so that natural human interaction is something that we have to maintain as compliance professionals and legal professionals. We have to maintain for all the tools that we have. We're still dependent on our communication with each other.
Yeah, well, I love just even the idea that there's still value in human interaction. It feels like we are moving further and further away from that. Brian, there's so many stories. I'm just outside of the healthcare space of just in the legal world where, and I hadn't heard that term hallucinations before, but just even things like attorneys writing full briefs with, using some AI platform with citations to cases and submitting it to the court, and ends up they got it wrong, and those citations don't exist. And I mean, those are horrible stories. So yes, it's a great and a very important tool to have, but if we over rely on that type of technology without having sort of that human element, that back end check, it can really be problematic.
It is, and it's going to be interesting to see how this will develop over the next 3, 5, and 10 years.
Mhm.
Um, artificial intelligence and the large language models and all of the terms that we're learning today, agentic, generative, large language models, right? All of those things, those are new terms to many of us. In 10 years, we're going to be using those and other types of artificial intelligence in our day-to-day work. Um, in our education and awareness and use case for artificial intelligence will continue to mold and evolve over the coming years.
Yeah, yeah, absolutely. So speaking of technology, I've had a number of clients that really, both as external counsel and in-house, that really strive for ways to just automate as much as they can. And obviously, there's administrative efficiency and automating processes. How is automation, in your opinion, changing the day-to-day work of compliance professionals?
One of the easiest things, and one of the things that I have found that it has tremendous value is looking at policies and the regulations. So a current really good use case for artificial intelligence for us today as compliance professionals is comparing our current written policies with the regulatory landscape.
Right.
And there's lots of ways to do that safely and unsafely. Right. And so work with I highly recommend build, if you don't already have a governance or some type of AI governance policy in place, it's time to start thinking about that. Work with your CISO, your CTO or CIO as a compliance professional and start having those conversations about how is our organization using technology to include artificial intelligence, and where and how can we do it securely. We can there are you can do everything from go to chat gtp as an individual private user, or Gemini or some other individual account, or you can use your corporate instance of Microsoft's Copilot, and Gemini also has a secure version. Google provides a secure version of Gemini, right? So it's engaging in those conversations with your technology teams and making sure that you're educating the workforce on how and what is available to use those technologies in a safe and secure environment.
Right. Yeah, yeah, so important, and it's just increasing the amount of, and I see the benefit in it. I mean, you're able to increase efficiency, reduce work hours, things like that. But the controls that need to be in place are really important. I want to shift gears a little bit to, it's still on technology, but the use of analytics. Yeah, I've been involved in a lot of Medicare, Medicaid audits where it was clear, and I know that government agencies are utilizing data analytics more and more now than they ever have, trying to, let's just use a billing context, trying to find outliers in billing for certain high risk CPT codes, and all of a sudden you get a request for documentation to justify those billings. If you are an outlier, it happens all the time. So how do you see, you have a front row seat, I imagine, to organizations that are using analytics. How are they using analytics to detect risk earlier so that they can maybe prevent some of those government agency audits?
I think it ties back into, I think we referenced earlier, the idea of having a data governance policy and how to manage data in your organization. That's been a theme for about 10 years or so. But organizations today, especially the most mature compliance programs, are using connected tools to their big data platforms and looking at all the claims data, developing their own algorithms for evaluating the outliers, right? So Dr. ABC is billing this procedure code 80% more often than his peers in our market, and then using that data to pull that data in those reports, and not only compare those trends to your organization, but how do you connect and find that information from other organizations? How does that compare to the CMS data? Right. And so building and then compliance professionals looking at those reports, those analytics, using those tools to define what is your roadmap for auditing this year and understanding where is our organizational risk based on what we're billing and how does that compare to the CMS data that we have access to.
Yeah, that's I love that. And admittedly, I'm not really savvy in the tech world, and so, but you're right. I mean, if we have the ability, we meaning the sort of collective healthcare organizations, have the ability to identify the risks that you just, as an example, Dr. So and so was billing, uh, this, let's say an E&M, evaluation management service level 5 at a significantly higher rate than anyone in the group or anyone in this geographic region. It is only a matter of time before, let's just say, assume it's Medicare, before the CMS or a MAC comes down and says, "Hey, let's look at some documents." So to the extent that we can, and we at this point, and be interested in your thoughts on this. At this point, what is the obligation of a healthcare organization to utilize these tools to identify these types of risks?
That's a tricky question.
Oh.
Obligation, don't, at least I'm not aware of a regulatory requirement that specifies the method of auditing. Um, but let me, that reminds me, I guess it was last year's HCCA conference, CMS and the OIG did a co-presentation, a panel discussion,
Mhm.
and they were very clear about their intent, the U.S. government's intent to use artificial. And they already have some of the best data scientists that we have in the country from a talent perspective, and now those same expert data scientists are using artificial intelligence tools to generate better algorithms to evaluate the assimilation of data, the big data that they already have of all claims. Our obligation is to develop an auditing program, right? Is we must assess as a compliance professional or a provider based entity, we must have some idea of where our risk resides from a billing perspective, and developing those routine monitoring and auditing audits, or whether those be samples or your what algorithm or tool we're using as an organization to ascertain the risk. That can be the old way to do that would be to sit down and look at the reports and look at our billing, meet with your CFO and your finance team and understand where is the revenue coming. Um, and it always goes back to the old adage of we have to follow the money, and understand where is our revenue coming from, who are the payers, and how are we structured as an organization, and where is that revenue coming in, and what are all the variables that generate that. And it takes a lot of hard work, right?
Yep.
Where automation comes in is understanding how to use what tools are at your disposal in your organization to better manage that data that's coming in and get more accurate and in the volume of reports that you're able to digest to ascertain the risk.
Yeah, yeah, I totally agree with that. I didn't mean to insinuate that there is some sort of regulatory obligation to use these tools. I agree with you. I'm not aware. I've never heard of, and there certainly is no statute or regulation requiring this. And I'm not aware of any OIG guidance that has said this. I'm just speculating. I mean, at what point, I mean, as you know, if there's some failure in the compliance program, it's not an excuse to say, "Oh, I'm sorry, OIG, we don't have the resources in our compliance department
Correct.
to do this." I'm just speculating. At what point is there going to be a point in the future when the failure or the absence of any of these tools, whether they're predictive tools, AI tools, analytic tools to identify these risks. I'm just wondering, for some speculation, if at some point the government says you got to use this.
I think as we sit here in 2026, um, we must be able to demonstrate we have a defined audit plan, and
Right.
and we have to be able to articulate how did we build this audit plan? What information and facts did we collect to inform this audit plan? How that will evolve, I think, in the coming years will be dynamic and fast. What tools are available to us right now? A lot of AI tools to perform these functions are really expensive and unknown and untested. As time goes on, we'll get better results from what tools are available. The cost will inevitably go down and make it more affordable. But to your point, you can't go to the OIG with we had this overpayment that was this much money and we didn't identify it because we didn't have a compliance and auditing team.
Right.
Right. That's not going to be a valid answer. That's when you end up with a corporate integrity agreement and a heavy enforcement action.
Right.
Um, if you can successfully defend the organization's posture from having a defined audit plan, that's where you enter into a more agreeable conversation with the enforcement agency, whether that be CMS or OIG, and being able to describe how your audit program works and how you're managing it. But that will, I'll freely say, I think that's going to change dynamically over the next 2 to 5 years.
Yeah, I agree. And quickly, I think very, very soon. 2 to 5 years seems right to me. It is changing quickly right before our eyes. So when we zoom out from technology for a moment, healthcare is also evolving structurally. New service lines are emerging. Private equity investment continues to reshape the market. Very much in the news. Workforce challenges, really impacting how care is delivered. Each of these developments creates some level of operational pressure. As you know, operational pressure often turns into compliance risk. I'm curious what your thoughts are on regulatory operational risks that are growing that most healthcare leaders maybe aren't paying enough attention to.
Well, the first thing on my list is new service lines. Regardless of technology or the regulatory landscape, one of the things that can introduce a new risk to a new organization is a new service line. So you small hospital or even a mid-sized to large physician practice, and you're adding a new service. And understanding what other compliance requirements in billing for that new service, and then what are all of the quality of care concerns that go along with adding that new service to your organization. But then circling back to the OIG, and we saw in the 2023 guidance document, investment in from private equity firms, right? With private equity entering the healthcare market with the mandate of the typical finance idea of we want to take this entity, make it more profitable, return, and then do something with it financially. And so the motivation there becomes to um, focus on on the revenue rather than the patient. And we'll see this consistently from the OIG. If we prioritize, if healthcare organizations prioritize revenue over patient care, that can always put us in a risky scenario for enforcement actions. Um, but that translates to people again, right? I mean, we still have to keep in mind, no matter what technology we still have providers at all levels interacting with individuals who need healthcare. And we're not going to get to the point where artificial intelligence is managing the care delivery itself, right? So we might have recommendations from the technology, but we still need our nurses and our doctors to provide the care to the individuals. And so that human element is always going to be that operational risk of making sure we're educating those folks like we talked about earlier, and providing an avenue for them to communicate and ask questions to the compliance team.
Yes, it strikes me that some of these risks that we're talking about, you mentioned the human element. And I agree with that. It's the professional judgment of the clinician, right? And that's the critics of private equity in healthcare. That's one of the main arguments that we don't want uh, this focus on profitability, and not that's not important, but getting more revenue to impact the decisions that a clinician makes with respect to healthcare, care of many patients, and um, same with AI, and just the recent FDA guidance with respect to clinical decision support systems, and ensuring that clinicians are not over relying on these AI enabled systems to make decisions for them, and making sure that, okay, yeah, AI is a great tool to present. I've got a patient here with this diagnosis and these symptoms. What are my options? Great tool. Links to peer review articles, and all the latest research and data. Ultimately, at the end of the day, uh, the scrutiny is on ensuring that these risks do not impact the professional judgment of a clinician, which is certainly important. We've seen I mean, the arguments are the same in private equity in other areas. We saw private equity is now entering into the legal community. They're snapping up law firms in the states that allow it, and it's kind of the same argument. We've seen private equity entering into college athletics. It's kind of the same argument in terms of kind of just turning into a money grab. And look, there are good things and bad things. I totally get it. It's sort of how do we interact with it? How do we ensure that at the end of the day we're doing the best we can for the patient?
I agree. And if I could, and this is, we didn't, for me and my personal philosophy for healthcare, it we can't grow the service lines and the care that we're delivering if the provider based entity is not revenue producing,
Yep.
right? There's got to be a balance. Even for our not for profit organizations, they have to operate in the black in order to grow. Technology investment into new modalities for imaging and new surgical procedures and equipment. All of those things cost. Those are expenditures or expenses that have to be accounted for, and we can't grow and provide better quality of care without some form of revenue. But it's a balance, right? And we don't want the private equity firm to be so focused on growing the revenue so much that we neglect, right? So one of the examples would be we're driving revenue up 100+% and we're not investing in quality of care, right? So I think when we're thinking about it from a private equity perspective, if we're growing revenue, that's great, but we should probably be investing back into what it means to deliver higher qualities of care and more service lines that are available to the communities that provider entity is serving.
Yeah, absolutely. I mean, at the end of the day, you hit the nail on the head. At the end of the day, I suspect that people on both sides of this argument, I mean, have one commonality, and that is ensuring that we're doing what's best for the patient, right? We're improving clinical quality. We are taking care of the patients the best that we can, regardless of the model of delivery. That is certainly true. Well, Brian, we sort of danced around this topic. We've really focused on where we've come in terms of technology the last several years. We've talked a little bit about what's forthcoming, what are the biggest risk areas in the next 3 to 5 years. And I'm just curious, and this doesn't necessarily have to be technology related, but just to put a bow on it, where do you see the biggest exposure developing in this space in the next 3 to 5 years?
I really have twofold. One, and it drives back to technology, and I may be biased because of my background, but the technology evolution itself will drive the regulatory landscape. Right, we have a HIPAA proposed final rule that's been out there for a couple of years now that has not been entered into the Federal Register, and it's been so long now that I think it's going to circle back, and we'll have to go back to a comment period before. But with the evolution of AI, and the emerging technologies, I think that that final proposed rule is likely subject to another comment period before it gets published. That's pure hypothetical, and I'm not an attorney, but having watched the OCR look at those final rules over the last 20 years, too much time has passed now, and so I think we'll probably look at an evolution there. And then for me, and I've been asking this question of my peers, and I was at a conference a few weeks ago, and I've been asking this question has evolved, and I think it's gonna and we've touched on this briefly, but I'm curious when we will see the first true enforcement action, either from the OIG or the OCR, that identifies artificial intelligence as the root cause. Because when that enforcement action comes, that will drive change. Whether that be on a billing and coding side or some type of HIPAA security violation, when we see an enforcement action that has AI as the root cause, that's gonna catapult everyone into light speed to zero in and work on what does it mean to govern this technology and how will it change.
Yeah, Brian, that is so good. I had this conversation with someone just the other day about yeah, there really hasn't been, as far as I know, an enforcement action that is really AI focused. And you can sort of make an analogy to some of the enforcement actions related to cloud data storage, and if someone's adding protected health information to an unsecure cloud storage environment, then that is certainly problematic. And I mean, and in the AI space, it could be very similar. I mean, someone's putting PHI into Chat GPT and asking X, Y, and Z, what should I do? Very similar, unsecured environment, but there really hasn't been an enforcement action. So I am curious as to what that looks like, and I think the industry really just doesn't know what that looks like.
And so I asked a good friend of mine who practices employment law
Mhm.
the same question the other day, and their area of practice is specifically employment law. And from his recollection, there's no government enforcement action there, but what he has seen is civil litigation. And there's a couple cases floating around. I can't remember which state, but there's a couple civil cases where um, individuals have filed cases and they have been screened out by HR resume screening from
Right.
artificial intelligence, and they're litigating in from a civil capacity, being screened out um, using artificial intelligence algorithms. And I think for us, it's not directly so directly related to healthcare compliance, but I think being aware of those, because I think it'll be the catalyst to what other enforcement action is forthcoming.
Yeah. Yeah. I completely agree with that. Uh, Brian, this has been awesome. I really appreciate your time. I like to close each episode with kind of rapid fire closing segment, like a lightning round. And I appreciate this. You may get a kick out of this. I actually I have a sponsor for this and I tried to tell the sponsor for the fives of listeners I have that used to be ones of listeners, now they're fives of listeners. So I have a sponsor for this segment, but just so everyone knows, the lightning round today is sponsored by Western Associates. It's a company that helps organizations create high quality branded merchandise and corporate products that people actually want to keep. So if your organization is looking to elevate its brand through custom merchandise, you can learn more at westernassociates.com or contact Mike Eldridge at M as in Mike Eldridge, Eldrivge at westernassociates.com. We'll also include a link in the episode description so you know where to get more information if you're interested. So Brian, I'm going to get you out of here on this. Just rapid fire. One compliance myth you wish would disappear.
It's still a cliche, but we are genuinely here to help you, right? We're not the enforcement. At least we don't intend to be the enforcement police internal. And we're not here to say no. We're here to help you find a yes, but a yes that will keep us all out of trouble.
Yep, I love it. One thing every CEO should understand about compliance.
It absolutely starts with the CEO. If the CEO is not invested in the compliance program, it'll fall flat. His subordinates, the executive leadership team won't follow it, and then that will just transcend. I've seen that happen in many organizations, and it is a dynamic shift when a new CEO comes in who's invested in compliance, and you immediately see the change in the culture.
That is, yeah, I'm going to echo exactly what you said. I've seen both sides of that as well, where you've got someone who, a CEO at the very top, that creates that culture that we're going to invest in compliance. But you know, when a very difficult situation comes up, we're going to err on the side of being compliant. And you know, I understand there's a spectrum of risk, but you're right. It starts at the top and flows down and creates that culture. Very, very important. Last one habit that makes compliance leaders more effective.
Being personable,
Yeah.
right? Understanding how to communicate with people. We're human beings and we have different personalities and different communication styles. One of the greatest skills a compliance professional can have is understanding how to read nonverbal cues, how to communicate effectively, where and how to approach sensitive subjects. And because it is still, regardless of all the technology, it comes down to how effective are we at communicating.
Yeah, that's great. That's great. Well, Brian, this has been a great conversation. One takeaway for me is that compliance is increasingly an operational technology discipline. It's not just a legal one. Organizations that understand that shift really will be much better positioned to manage that risk going forward. I love the wisdom that you've dropped on us today, and I appreciate your time and the conversation.
Absolutely. And if anyone's interested in Healthicity's software solutions or our professional services, you can find us at healthicity.com. That's healthicity.com. And we would love to talk to anyone who's interested in our software or professional services.
Absolutely. Yeah, absolutely. Appreciate it. Well, thank you so much, Brian. Appreciate your time.
Have a great day. Thank you.
You too. Take care.
Thank you for tuning in for another episode of Health Law Pulse, which has been brought to you today by Health Law Counsel LLC, a health law firm you can rely on. For more information about the services of Health Law Counsel LLC, you can visit my website at www.healthlawcounsel.com or email me at john@healthlawcounsel.com. I want to thank Brian for his time today and sharing with us his expertise. You can learn more about Healthicity and its services at healthicity.com. That's healthicity.com. If you can, and if you enjoyed today's episode, subscribe, leave a review, share it with a friend. We are on YouTube, Spotify, and Apple Podcasts. You can also find links to these episodes on my website, again at www.healthlawcounsel.com. We'll be back soon with more conversations at the intersection of healthcare, law, technology, and leadership. Thank you for tuning in.